Okay, beginning with interventions on page 1206. Rest is important for individuals with viral hepatitis, especially during the acute stage of viral hepatitis. Rest helps to reduce the liver's metabolic demands and increase its blood supplies. The patient should have a diet that's high in carbohydrates and calories with moderate amounts of fat and protein. Small, frequent meals are provided to these patients and most often preferable. Drugs are used sparingly to allow the liver to rest, but since chronic hepatitis B and chronic hepatitis C can be life threatening, antiviral and immunomodulating drugs are given. Now, a primary focus for patients with viral hepatitis is preventing the spread of infection. We want to make sure that for those fecal oral routes that individuals are carefully washing their hands and they're disposing of feces in the proper and sanitary way. Now, education is very, very, very important. As far as viral hepatitis, for these patients when they go home and they prepare for self-management, we want to make sure that they're avoiding any alcohol. We want to make sure they're avoiding acetaminophen unless, it's prescribed by the physician. We want to make sure that they're resting frequently throughout the day and getting adequate sleep. Now, on page 1208 begins fatty liver or steatosis. Fatty liver is caused by fats in and around the hepatic cells of large accumulations. Non-alcoholic fatty liver disease and non-alcoholic steatohepatitis are two types of fatty liver disease. Fatty liver can be caused by an elevated lipid profile, most often obesity and diabetes mellitus. It's normal for an elevated ALT and AST, or a normal ALT and elevated AST. Now, with liver trauma, we have to remember the liver is very vascular and it receives a lot of the body's cardiac output. We want to make sure we're observing for any types of signs of hypovolemic shock, such as hypotension, tachycardia, cool, clammy skin, tachypnea. Okay. Now, cancer of the liver. Cancers, they can be primary or they can be metastatic cancers. Cancer of the liver is most often seen in the Asian and Mediterranean areas. The disease affects Vietnamese men more than any other group, and Black and Hispanic populations have twice the rate of the disease as Euro Americans. Chronic infection with hepatitis B virus and hepatitis C virus can lead to cirrhosis, which is a risk factor for liver cancer. Now, in the early stage of liver cancer, typically the individual is asymptomatic. Surgical resection and liver transplantation are the only treatments available. Remember, we want to make sure that these patients, if they're going home with any sort of tunneled abdominal drain, that we need to teach them not to remove more than 2,000 mLs of fluid at one time to prevent hypovolemic shock. And we need to teach them the signs or the indicators of hypovolemic shock. Now, chemotherapy can be given, but it's typically not effective. Patients with advanced liver cancer, they are going to need end-of-life care and hospice services. Okay. Now, liver transplantation on page 1209. Most diseases can cause liver failure, and cirrhosis is one of the most common reasons for liver transplants. Remember, cirrhosis is scarring of the liver. Now, chronic hepatitis B and hepatitis C, any type of autoimmune liver disease, any type of alcoholic liver disease, any type of fatty liver disease, those are all other reasons for transplantation of the liver. Now, patients that are not considered for transplantation of the liver are those that cannot follow instructions and they do not manage their care at home well. Those that have severe respiratory disease, any type of metastatic tumors, and those that have cardiovascular instability, some sort of end-stage or advanced cardiac disease. Now, candidates with the highest level of acuity receive the highest priority. Acute graft rejection and infections are the most common transplantation complications. Typically, the patients are prescribed cyclosporin A, which is an immunosuppressant drug. In the early post-transplantation period, infections can occur such as wound infections, UTIs, and pneumonia. Um, this typically, transplant complications cause individuals to be very anxious. It leaves a major psychosocial impact on these patients. Now, there's a table on 58, on page 1210, 58-5, that lists the assessment and the prevention of acute graft rejection, infection, hepatic complications, and acute renal failure. Just remember to teach these patients about any types of side effects from their immunosuppressant drugs, such as nephrotoxicity, gastrointestinal disturbances. And I will be beginning the next audio of chapter 59.